All right, so our last presenter and probably one of our most important presenters today is going to round out the morning for us. So we're going to have Richelle come up and share her son's story with all of us.
So our journey begins February 24th of 2017 when my beautiful baby boy Connor was born. A week later, I received a phone call from a pediatric neurologist from Strawn Hospital stating that a newborn screening test had come back positive for adrenoleukodystrophy. She wanted to know if I had any other boys, to which I did, a 14-year-old and, or at that time, 7-year-old and 2-year-old. But I didn't understand the importance of this nor what adrenoleukodystrophy even was. I had never even heard of it before. She said she wanted to see Connor, my oldest, that week and advised me to Google the condition. After making the appointment and ending the conversation, I Googled the word adrenoleukodystrophy. My jaw dropped and my stomach was filled with nausea. I saw horrible images and heartbreaking stories. The news was basically to what I had thought was my son's death sentence, not knowing how much of a blessing it was for his future. There was also the concern for my oldest son, who had not had a single MRI his whole life flowed through my thoughts. Finding out that this was genetic just couldn't sink in. How could I have given my children something I had not even heard of before? We met with a neurologist who tested my oldest and myself since my middle was negative on the newborn screening. The results came back positive for both of us. We scheduled Jaden's MRI shortly after, and thank God his results were clear. As scared as I was for my children, I had told myself I was going to learn everything I possibly could about adrenoleukodystrophy and be prepared to go to battle. I decided to put the monstrous word into Facebook and see if anything had popped up. Thankfully it did, and I was connected to families with all different types of experiences. Some were sad, others were hopeful, and a lot were heartbreaking, but I found the love and support we needed. Although one story introduced me to another monster I had never even thought of. This boy had a match, but even so, he gained his angel wings not from ALD, but from graft versus host disease. It made me wonder, what if Connor didn't have a match? What would we do? How do you prepare for that possibility? I knew of other families that were able to see if they had a match for the just-in-case scenario, so I inquired from our home doctor, who told us that they only search for matches if it was actually necessary. Eventually, that day would come. Trying to prepare mentally for the possible nightmare news of an ALD present MRI would never truly prepare me for the actual news of one that came in September of 2022. Connor was 5 years old, and we were waiting in the ER room as his endocrinologist was concerned he was having an adrenal crisis. His My Chart popped up with test results, and I was assuming it was his blood work for the test he was having to make sure he wasn't having a crisis. But there was his MRI results. I didn't have to read all of it, but I saw a T2 flare and some other medical terminology I didn't understand, but I knew what it meant. I had the nurses call a neurologist, who called and said that he just saw the results and confirmed it was the nightmare I had been dreading. We discussed our options and that we could do a transplant there at Strawn or a few other places outside of New York. However, at that time, we only had New York State managed Medicaid, and they had previously told me that transplants are available in New York, so they wouldn't cover outside of New York. We decided to do it in Rochester for insurance purposes and be closer to home for the other kids. However, a couple of days later, I received a phone call from Dr. Stone, our home neurologist, who told me that the team at Strawn refused to do Connor's transplant out of respect for his life, as they had never done a leukodystrophy transplant before. He continued that he had already contacted the team in Boston, and as that was my choice outside of New York, he advised that they wanted to see Connor, and he told them about my concern of insurance, but was told not to worry about insurance, get Connor to Boston, and we will worry about the rest later. Connor's appointment was set for a couple of weeks out, and that Saturday in between, our home nurse Nikki called excited and asked if I had heard the wonderful news that gene therapy was approved by the FDA. I had, and was wondering what this meant for us. She said it gave us another option, as Boston was able to give the treatment. A true blessing from above. We met with Katie and Dr. Eichler, who said Connor's disease progression had just started with a Leigh score of 1, and asked if we had told Connor why he was there. I told Dr. Eichler that we really didn't know what to say to Connor. He was only 5, and how do you deliver that? Dr. Eichler looked at Connor and said, Connor, you have a boo-boo on your brain, and we are going to fix it. Perfectly put. I asked about gene therapy since the story of graft versus host disease never left me, and Dr. Eichler told me I don't see why we can't explore both options, and we should. We then met with Dr. Duncan, who went over the risks and benefits of both traditional bone marrow transplant and gene therapy. While our mind was already on gene therapy, we were waiting for HLA typing to come back, as it takes a few weeks. I remember the phone call from Dr. Duncan. She advised that Connor only had one less than perfect match and he was older than they would like, and that my other son was only a half match. My thoughts flooded thinking about the parents before me who had received this kind of news, how devastating it must have been for them. I started crying. Dr. Duncan said, I'm sorry, I know I feel like I'm giving you blow after blow. And I told her that they were happy tears, because before today, there was no other options, but today we had another option. Although the concern of insurance paying for Skyzona was our next battle. Once again, we were advised not to worry about it, that as a parent, we should only have to worry about our son, that the insurance team would handle it. Our approval came in the week of Thanksgiving, and we were truly thankful. Skyzona went commercially live in January, so we waited patiently, and then the first week of January, we were back in Boston for apheresis, where they take Connor's own cells out of him and send them to Bluebird Bio. 2 months later, we got the news that Connor's beautiful cells were ready for him. 2 years ago this month, he received those beautiful cells, and he is thriving. Disease progression has halted. He's doing well in school, and he's so full of life and enjoying his favorite game of Roblox. Even with the risk of MDS, I would choose gene therapy over and over again rather than take the chance of what path graft versus host disease could have dealt us. The way we see it is we at least bought our son time. I want to truly thank Elisa for giving Connor a second chance at life. Without newborn screening, we would be losing Connor, if not already have lost him. I want to thank our home team, Dr. Stone and Nikki Walsh, and Dr. Eichler, Katie, and Dr. Duncan, and a heartfelt thank you to Bluebird Bio for taking the risk of treatment for such a rare disease, and I hope that during this transition that you remember Connor and all the boys that Skyzona has saved. So thank you.